Hello, everyone. My name is Afrah Mohammed. I am a DHA student at Franklin University. Here I present my open-ended survey data, which is part of the qualitative study that I performed to explore the role of patients' health education in the care of patients, specifically those have chronic conditions. Let's start. So, as a background for this topic, let's start by defining health education, which is providing patients with the information they need to understand their illness, medications, how to effectively maintain self care practices, and every aspect of their health decision making. And health education is important because researchers prove that it's an effective strategy to reduce the risk of disease complications. Not only that, but also improve patients' awareness, positively impact many patients' outcome. That's why we are studying this topic. So, the purpose of the surveys I performed in this study was to explore the participants' perspectives on the current health education practices, methods, and materials. And I have two research questions. The first one, how can health education be a valuable tool for patient care? And the second one is, what are the participants' preferred and effective health education methods and tools? So I conducted two open-ended surveys. The first one main focus was the inpatient's health education. That's the health education patient received while they are admitted in the hospitals. And four themes emerged from that survey. The main themes were the effectiveness of inpatient health education, and I have many patterns and codes extracted under that themes. You can see them on the screen. And the second theme was the health education materials, and the participant discussed the different types of materials they received during their experience with inpatient admissions. And the third theme was the health education provider. And through this theme, the participants shared their insight on who should perform the health education. And the last theme was opportunities for improvement, and it was a very rich experience learning from the participants' insight on that. So, for example, they discussed how the discussion of transition of care might help patients. They discussed how more information about medication and complication related to them might help patients. And furthermore, on the other hand, the second survey focused on the health education materials themselves, because after analyzing the data from the first survey, I realized that I need to understand more from the participants' experience in that dimension. And the five themes emerged from this survey were the health education content and what they should include, the health education methods and what are the preferred methodology for our participants, and the focus on digital health education was one of the areas that enriched the results of this discussion. And the fourth theme was health information sources, when the participants share their preference about whether to seek the health information on their own or to take that from the healthcare providers. And the final theme under this topic was the role of health education in behavioral change. So these are very important themes for any future research in this dimension. And I really appreciate all the feedback and the experience shared by the participants. So, in conclusion, health education is a cornerstone in patient care, and the participants in this mini qualitative study provided valuable insights for the first research question about ways by which health education might be a helpful tool in patient care, especially while they are admitted in the hospital. Although further research is needed to explore the patient's preferred and effective health education methods, because this study was conducted with healthy individuals, and I think it worth redoing again with actual patients to get further insight from them about how can health education be done in a better way. That's all for this short presentation. And here are the references used for this presentation. Thank you so much for your time and best of luck.